Hi, I'm Bal Dhinsa. I'm a trauma and orthopaedic surgeon specialising in foot and ankle surgery, and I work at the One Ashford. So osteoarthritis normally occurs as a result of damage to the cartilage, which lines the bones within the joint. Now in the hip and knees, it's typically due to arthritis due to wear and tear or inflammatory arthritis. But in the ankle, it's normally due to trauma, and that's when the cartilage gets damaged because of a fracture or repeated sprains. And that changes the forces within the ankle, and it leads to secondary wear and tear of the cartilage. Patients typically complain of pain and swelling around the ankle, and the pain is often worse at the beginning of the day, and it can progress during the day to in the evening to having significant swelling. And when they come to see me, they often have restricted range of motion, and they complain of stiffness as well. And when we examine them, when it's quite severe, they often have some deformity within the ankle as well. It depends on the stage of the arthritis and how that's affecting the patient. It can start off with simple measures such as changing physical activities, modifications in day-to-day activities, and changing footwear as well. Then you can have painkillers to help with that, as well as anti-inflammatories. And then the next steps is physiotherapy as well. If things are not settling with that, or the symptoms are progressing, you can consider operative interventions, which initially may be an injection into the joint with the steroids, or it may progress to having keyhole surgery if there's this impingement, which is where there's a mechanical block to movement. And that requires coming in for day surgery. We do 2 little incisions at the front of the ankle, and we clear away some of the bone and some of the soft tissues to help improve the movement. With the more severe arthritis, you may need to consider possible ankle replacements or ankle fusions. And this is where we join the 2 bones of the ankle together. So it all depends on the discussion between the patient and the surgeon. With an ankle fusion, we're looking at joining the 2 bones together within the ankle joint. So this leaves you with stiffness, and it has the risk of increasing the risk of arthritis in the neighbouring joints. However, it does give you pain relief, and it was the gold standard management for young, active patients because it's a one-off surgery and it allows them to keep mobile without any risks. However, with ankle replacements, it gives you some mobility within your ankle joint because we're just replacing the arthritic areas with metal components, and there's a bit of plastic in the middle which allows you to move your ankle a few degrees. So this protects the neighbouring joints. The risks of this are that it can wear out, and therefore if you're an active young person, there's a risk you'll need a revision surgery, which is complicated. And therefore you need to have a discussion about the pros and cons of both and depend it and custom it based on the individual patient. So from recent evidence and literature, it's shown that with ankle fusions, there's increased complication rate compared to replacements. But with replacements, there's increased risk of revision surgery. So certainly, whilst it's controversial, both have got good technology and good evidence and needs a discussion with the individual patient. Depending on what we do, so with the keyhole surgery, as I said, it's day case surgery and you go home the same day and you're protected with heavy bandaging. And once you're mobile on that leg straight away, and once the bandaging's down, you're free to start with physiotherapy, which normally takes about 2 weeks. With the ankle fusion, you're normally in a plaster for 6 weeks with no weight on the leg, and then you go into a boot for a further 6 weeks, and you can place your leg down and put some weight on it. With an ankle replacement, you're looking at being in a boot or plaster for 6 weeks, and then you get going with activities after then. It's important that if you develop symptoms that you get seen fairly quickly because you need to get on top of it as quick as possible. So if you develop symptoms of pain, stiffness, swelling, it's important to see a doctor and try and get a referral in so we can start the process of management quickly and avoid the progression of the condition.